Okay, guys, for this second part of the video, we're going to talk about the peritoneum. Okay, and the peritoneum is essentially um, a very thin layer of tissue, a membranous layer of tissue that is protecting your organs in the abdominal cavity typically. And so the abdominal viscera are typically going to be suspended in this peritoneal cavity by the folds of this peritoneum that are on this area, or they could sometimes lay outside um, of this peritoneum. So the organs that are organs suspended in the cavity are referred as intraperitoneal because they are protected entirely by the peritoneum, both anteriorly and posteriorly, right? So those are what we call the intraperitoneal. And then we have organs that are considered outside of the peritoneal cavity, with only one surface or parts or one part covered by the peritoneum, which we call retroperitoneal. And so there could also be a third division, which we're going to talk about in a few minutes, which we call secondarily retroperitoneal. We'll talk about that in just a second. But some of the subdivisions of the peritoneum, we have the greater sac, and then we have the omental bursa, right? So those are some of the subdivisions of the peritoneum. Now let's talk about the layers. So the peritoneum is divided typically into two main layers. We have a parietal peritoneum, which I mentioned on my previous video, which is the outermost layer, typically lining the wall of the abdominal and pelvic cavities. And then we have the visceral peritoneum. This one, it's the inner layer, covering the abdominal and pelvic organs. Okay. Now, the peritoneal cavity, it's a potential space between the parietal and visceral layers. Sorry, people usually bother me when I'm busy. Um, so this peritoneal cavity, it's going to contain a very small amount of fluid, specifically serous fluid. And it is a closed cavity in males, but in females it's more significant because it allows the communication with the outside via the uterine tubes, uterus, and the vagina. So that's mainly the importance of that peritoneal cavity. Now, the peritoneum, it's going to have some folds, and so these folds are going to be forming specific ligaments, right? And so we have two-layer peritoneal folds that are connecting an organ to the abdominal wall or another organ typically. So one of the main ligaments that we have to talk about is the falciform ligament. This is one of the most important ones. So the falciform ligament, it's a peritoneal fold that's going to connect your liver to the anterior abdominal wall above the umbilicus. And it's a remnant, actually, is one of your remnants, embryologically speaking. Okay, so that's one of the most important structures. We're definitely going to see it in the cadaveric dissection as well. We also have a coronary ligament, which is a peritoneal fold that connects your liver to the diaphragm. You have a splenorenal ligament connecting the spleen to the left kidney, and we have a gastrosplenic ligament connecting the spleen to the stomach. So those are important. Now, earlier I did told you about how your organs and the peritoneum have a relationship, right? And so the way in which the peritoneum is being folded, because essentially this is all that there is. The peritoneum is being folded, and because of those foldings, some of these organs are going to be fully protected by the peritoneum. And in other cases, some of these organs are going to be only partially protected. So that's what that means. All right. So the intraperitoneal structures are suspended from the abdominal wall by the mesenteries. And here I have given you some examples that didn't really erase very well, but anyways. The intraperitoneal organs, two examples I can give you is the stomach and the spleen. Those are intraperitoneal, which means they're inside and protected fully by your peritoneum. Then you have structures that are not suspended in the abdominal cavity by a mesentery and that lie between the parietal peritoneum and the abdominal wall. And these are considered retroperitoneal, and they're partially protected by the peritoneum. And so those are, for example, your kidneys and the rectum. We're going to talk about kidneys when you get into the posterior abdominal wall. And then thirdly, it says here, during the development, some organs are suspended initially by the abdominal cavity and by the mesentery, and later become secondarily retroperitoneal by the fusing with the abdominal wall, because it has to do with the way in which they are rotating as we are forming inside our mother's womb. Those organs start to rotate, and by the time they finish their rotation, then they end up being secondarily retroperitoneal, because initially they were retroperitoneal, but then initially they were protected. And then they became secondarily retroperitoneal because of the way in which they rotated. So that's going to be two examples here, your duodenum and your pancreas. So those are two main examples. Now let's go over these peritoneal folds, because some of these folds have specific names. And so based on their location and where they are, they're going to have a different name. So let's start with the omentum. This one consists of two layers of peritoneum which pass from the stomach and the first part of the duodenum to the viscera. And so there are two omentas. There's a greater omentum and there is a lesser omentum. Greater omentum is typically the one that they usually call it the apron. It kind of looks like a fatty skirt protecting the organs in that area. So this one is derived from the dorsal mesentery. It's a very large peritoneal fold that attaches to the greater curvature of the stomach. If I move myself to the side, you can see it right here. It's coming from the greater curvature of the stomach and the first part of the duodenum as well. The blood supply for this area, it's going to be the right and left gastro-omental vessels. And then we have the lesser omentum. This one, if you look at this picture right here, here's your lesser omentum. This one, it's a very thin membrane that it's going to extend from the lesser curvature of the stomach. So here you can see that lesser curvature. From the stomach and the first part of the duodenum to the inferior surface of the liver. And it's usually very thin. Usually in this area, when we dissect, we're definitely going to have to break through that omentum. And so here you can see that in this cadaveric dissection, this is more superior, this is more inferior. You can see that in this picture, they have already reflected partially the muscles of the anterior abdominal wall, and you can already see or appreciate that greater omentum right there. So it quite looks like a layer of fat. And so eventually you can quite literally take that greater omentum and reflect it to observe other structures of the peritoneal folds. So for example, right here, we are going to see the mesentery. This one, the mesentery is, here's the root of the mesentery from the posterior abdominal wall, closer to the posterior abdominal wall. This is a very large fan-shaped fold of the peritoneum that is going to be connecting your jejunum and ileum to the posterior abdominal wall. So quite literally allows them to hang in there. And so the other part is the transverse mesocolon. This one is a fold that connects the posterior, got lost here. It's a fold of the peritoneum that connects the transverse colon to the posterior abdominal wall. That's where I was going for. And then lastly, you have a sigmoid mesocolon, which you can actually see right here. And this one, it's more like a V-shaped fold attaching the sigmoid colon to the abdominal wall. Let me move myself to the side so you can also read it as I am reading myself here. So you can see it right here. Okay. So like I said, if you lift that greater omentum together with parts of the transverse colon, which is what we have in this picture, you can appreciate better that transverse mesocolon right here, that mesentery that is holding onto your small intestines. And then this right here, the sigmoid mesocolon. More recently, in recent studies, they have actually classified each one of those as specific organs. They are organs of the body. Now, let's talk a little bit more about the omental bursa and the foramen, the omental foramen, and where is it located, where does it come from, right? So these are, so essentially the duodenum, together with its dorsal mesentery and parts of the pancreas, will swing to the right, and then it fuses to the body, right? Like during embryological stages, your organs, your abdominal organs, are constantly rotating to finally get into the location where they should be. So in the secondary fusion of the duodenum to the body wall, there's going to be a growth of the liver, and there's going to be other structures growing in there and rotating. And the fusion of the superior surface of the liver to the diaphragm is going to be restricting the opening of the space enclosed by the dorsal mesentery in association with the stomach. And so that opening is the omental foramen or epiploic foramen, which you can see right here in the cadaver. You're going to be able to quite literally insert a structure like a probe on that area, for example. And then the part of the abdominal cavity enclosed by the expanded dorsal mesentery and the posterior to the stomach is the omental bursa or lesser sac. So that's super important also for your lecture test. And so that continuing with these abdominal cavity, the way in which these organs are positioned in the position of, in general, of your abdominal cavity, it's going to create two compartments. We're going to have what we call a supracolic compartment and an infracolic compartment with a right and left. That's what the R and left and L means. With a right and left infracolic section of this compartment. So just like you saw on that picture, that's what I was trying to go for with this pink square, is to depict what the supracolic compartment. So this is an area located at the superior to transverse mesocolon, and it contains organs like your liver, your spleen, and your stomach, and the lesser omentum. On the infracolic compartment, as the name implies, is inferior. This one is inferior to the transverse mesocolon, and it's divided into right and left, like I just showed you, with infracolic spaces by the mesentery of the small intestine, as you saw right there. Let me move myself to the other side so you can actually appreciate it. Some of the last things that I do want to talk about on this lecture, it's the paracolic gutters. Because of the way in which the organs are located, it's creating these spaces, right? A left and right paracolic gutter. These are spaces in between the posterior lateral abdominal wall and the lateral aspect of the ascending and descending colon in this particular case. So your right paracolic gutter would be this space right here on the right side in between the wall and the ascending colon, which is this one right here. And then this is your left paracolic gutter between the wall, the abdominal wall, and your descending colon. And so they allow the communication between the supracolic and infracolic compartments that we just went through. Last but not least, on this video, we're going to talk about a quick clinical correlation, which is peritonitis, which is every time you see the word itis at the end, it's an inflammation of something. So in this case, it's an inflammation and infection of the peritoneum due to different situations, right? For example, appendicitis, which is the inflammation and infection of the appendix. It could be a penetrating wound to the abdomen or perforating ulcer, or like due to surgery and poor sterile techniques, etc. And that's typically treated with antibiotics. All right, and here are my references, and I hope you guys have a good rest of your day or night.